Hi there, and welcome to Women of Wedgwood. I'm Vivian Tremont, and I have the privilege of serving as the Chief Advancement Officer here at Wedgwood. Now let's give our friends just a moment to join us. So please go ahead and say hello in the comments. Let us know you're here. Also, we'd love to take your questions at the end of our interview. So go ahead and key those in. We will answer your questions today. So thanks so much for being here. Let me introduce our guest today. Our guest is Dr. Dan Gowdy. Dan is the President and CEO here at Wedgwood Christian Services. Dan joined us in May, so what a transition it's been. We appreciate you making the time, Dan. Thank you.
Thanks, Vivian. Wow, right?
Right,
Wow.
right.
And this is Women of Wedgwood. This is so much fun. So thanks for inviting me. I'm glad to be here to talk about my favorite subject, Wedgwood, and the amazing people that make this mission happen every moment of every day. Thank you.
Thank you. All right, wonderful. Well, let's start talking about Wedgwood in general, overall, right? Some folks are new to Wedgwood and they want to know, they maybe have heard of Wedgwood, they understand it's a fantastic nonprofit
Yes.
doing great stuff.
Yeah.
Give us some specifics. What happens at Wedgwood?
Wedgwood is a great organization, Vivian. Thank you. It is. It's been around for 60 years, and it serves youth, adults, and families, and primarily through intensive residential treatment. Has it been able to, through grace-filled care, transform lives, and it has been doing that for decades in our community. Not too many people know that, and I wonder what they would think if Wedgwood wasn't here. I think we'd really see some of what this community benefits by Wedgwood. We also provide counseling services. So as we focused on serving the youth, we understand that if we want to serve the youth well, we need to serve the family, right? Because abuse and neglect doesn't just affect one individual, right? It affects the whole family. So if we want to serve the youth well, we need to serve the family. We provide counseling services, focusing on trauma-informed care, as well as substance use disorder and recovery. And another area is our prevention area. We provide education services. So we go out into the community, into schools, come alongside administrators, counselors, and educators to help them identify the symptoms of abuse and neglect early on, how to build meaningful and healthy relationships between peers and within family groups. One of our behavioral health specialists kind of summed it up best. She says, "I love this job, Dan. I know my day-to-day activities has a real impact on the youth and children we serve, especially at this pivotal, impactful age in their life. And because of that, I know I'm making a real difference, right? And I think that's what drives our staff. Knowing that each day, facing some of the toughest situations, some of the most overwhelming stories that'll just, Vivian, break your heart, of abuse and neglect, they show up every day with the idea of changing and transforming somebody's life. And not just a life, but the life that they can live, a hope for a future life. It is truly remarkable. And the work that they do, sharing that hope, really, in very real terms with people, with youth and families who come to us each and every day, is truly remarkable. I'm so happy to talk to you about it.
Good. Thank you. I love your enthusiasm, Dan. Thank you. Now let's talk a little bit about the impact of 2020.
Yeah.
You know, you are leading an organization that's at the front lines of mental, emotional, behavioral health.
Yeah.
What was the impact of 2020 on our nation and the community from your perspective?
Right. I mean, we're doing this virtually, right? And we have masks on. We're obeying the protocols and everything like that. But that's just normal right now for us. But what we're seeing and from youth and families' perspective is really concerning, Vivian. We see it like what's happening around us, much like a seismic event. So imagine two tectonic plates colliding in the ocean, creating a wave, a tsunami, if you will. Well, that's what's really going on right now, virtually. We have the ongoing pandemic colliding with unrest, social and civic injustice, colliding the ocean, creating a tsunami, a mental health tsunami, if you will. And that's building, that's heading our way. And we don't know how high it's going to get, when it's going to peak, when it's going to crest. And our fear is it's going to grow beyond what we're able to manage and support. Let me give you some numbers real quick. In June of this last year, they did research. 40% of adults said that they are struggling with mental health and substance abuse. That's overwhelming to me. And I think it's safe to say that number has gotten probably a lot worse since then, right? And looking at this mental health tsunami, what we also know about it is disproportionately. It's affecting young hearts and young minds, ethnic and racial minorities, essential workers, as well as adult caregivers. And so that's what's building on one side. And I'm sad to say on the other side, there's complications here. So what we've also seen locally and nationally is a significant reduction in the number of reported abuse and neglect. That's incongruent. Right. We know that 70% of individuals that with a substance abuse disorder have experienced trauma in their life. Right. So there should be a correlation with the two, but they're going in opposite directions. What's going on here? Right. The best analogy I could think of is as that mental health tsunami is approaching shore, it's drawing the water from the shore, right? And it's making the tsunami even higher and more daunting. And we feel when it finally gets to shore, people are going to come to us with more decompensated, more damaged. Okay. Trauma is going to catch hold. Abuse and neglect are going to permeate throughout the families. And substance use will more people will go down a darker road in that area. That, unfortunately, is what I believe that we are facing, what our Wedgwoods of this world and other human services are facing moving forward. And when that tsunami peaks, and when it reaches shore, maybe sometime off, or it may be, around the corner. We just don't know.
So Dan, that's interesting. Why do you think there are fewer reports, as you mentioned, happening of incidents now, if we know and understand that there times are more trying? What's the disconnect? What do you attribute that to?
The isolation that's keeping us safe from the virus is also the contributing factor on our ability to identify people in need. People are working more remotely, and people are going to school more remotely. So no one is identifying or offering to seek help because there's no eyes on people in need. And so people go farther down this road, and because we're not at work, and we're not working together, and we're not going to school together. And we have to be vigilant in that area. It's going to take extra work.
Okay, so the teachers and the coaches, those professionals who may have seen signs, they're not able to do so right now. Yeah. Understood. Yeah. Okay, wow, powerful. Yeah. All right, so then let's talk specifically about Wedgwood and how all of this tsunami that you're speaking of, how has it impacted Wedgwood specifically?
Well, it was devastating and exhaustive and complete. Devastating in the situation where we have intensive residential treatment, and individuals coming to our care are responding and dealing with their own trauma in their own life. Right. And what do we all do in March? We lock down, right? We isolated ourselves to keep ourselves safe. But a youth coming to us, 8 to 18, that have experienced trauma, and then while they're receiving treatment from highly trained individuals, they're having to do it through masks and through gowns, but also in a lockdown setting, which could be trauma in of itself. Imagine somebody coming to our doorstep, having attempted suicide, who's literally been secluded and isolated, and then going into a safe place to be, but because of health reasons, had to be secluded and isolated. That our clinicians had to work that much harder. So the level of anxiety of the youth and and our staff, our professionals, really was elevated during that time, and they were amazing. I mean, still continue to be working double shifts, taking care of individuals. One youth that we had was really struggling with this. It was just too much. Had to leave. Had some behavioral issues. Had to leave. But when he came back, staff were there to meet them on their day off, to be there, let them know you're back in a safe place. We love you. We're glad you're here. That's that grace-filled care that really matters. Our counseling program, education program, had to shift on a dime. Had to change. So in order to still stay connected where people are at, we had to embrace telehealth. And that has its own unique challenges. Imagine you're a master's level social worker, PhD, you have all these skills on this relationship, and now you have to do it through a screen, right? And those amazingly talented people don't always know, that skill is something that had to be learned in the moment. And they were amazing. They were absolutely amazing. Engaging families, using multiple screens, using games and interactive tools when you're trying to keep people engaged in the moment. But the struggle's been there. Imagine low-income individual not having a computer,
Right.
having to use mom's phone,
Right.
and mom's getting text messages and calls while they're at it. It could be a huge barrier.
Okay.
The silver lining, though, Vivian, if I could, is one of our clinicians said, I've been able to make some breakthroughs with the individuals I serve because they felt safer in that space, two-dimensional space. Our kids growing up, they share everything about their lives online,
Interesting.
and they were able to make some tremendous breakthroughs
Okay.
virtually than maybe they might otherwise, because of feeling safe. They were in their own home, they were in their own bedroom, and sharing with the counselor on the other end.
So that buffer,
Mhm.
we can call it, was actually a blessing. It gave them a little bit more
Yeah.
ability to really be vulnerable.
Yeah.
Is what happened.
Our clinicians were very surprised,
Right.
thankfully surprised to
Right.
hear that one and see that one. So that's one of our learnings.
Okay.
Yeah.
Okay. And prior to, last March, had Wedgwood been offering teleservices, telehealth?
Had to switch on a dime. Yeah, had
Okay.
to switch, and that's part of what we do now.
Okay.
It's just part, and I think moving forward,
Okay.
it's going to be something that's going to stay with us.
Okay. And the results are there. We know it works. We
Yeah.
know it works for many.
Well, otherwise, the tsunami is going to just consume them and
Sure.
take them away, and I think they'll go black and they'll go dark, and so that's what we fear. It's a way of connecting, staying connected in a very real way, providing real therapy in those places where they're at. It's real convenient, because you can be at work and all of a sudden the individual can connect and have their counseling session and then go right back into the other part of life. So that's why we think there's parts of it, at least hybrid, that's going to be here to stay.
Excellent. I would imagine too, Dan, that folks who live in the outlying areas, maybe more rural communities, it's been a blessing for them.
Yeah. Imagine driving 20, 30 minutes and so
Right.
forth. Wedgwood serves 9 counties, right?
Oh,
And so up Mecosta, Newaygo, and so forth, in some of these wonderfully rural areas, it takes a while to get there, especially on days like today, winter days and others. That makes it even more a potential barrier. So yeah, rural areas are a great focus. The connectivity there still needs to be, you need to have the Wi-Fi connections and so
Sure.
forth. But usually we can work around those things.
Okay.
Usually we can find places for that. Yeah.
Excellent, excellent. Let's talk about what we learned in 2020 about mental, emotional, behavioral health. What did we come away with?
Social connections, Vivian. We are wired to connect with each other, aren't we? Right?
Amen.
And right, and some of us more than others. But with that, I think what we've learned, Vivian, is that it can also help with and hurt with mental health and mental recovery. So when we're connected, the researchers tell us it helps with depression, overcoming, even in recovery from substance abuse. When you're able to be connected with others, whether it's peers or like-minded or natural supports, whatever that is, and just general mental and physical health, we're better off when we're connected with people. That's what I think has been more evident. Consequently, if we're disconnected or we're isolated, it makes all of those things that much more difficult. So I think what we've learned is how important those social connections are. How do we take advantage of the technologies, that all the efficiencies and connectivity to particularly remote areas and so forth, but at the same time be all about relationships and those meaningful, substantive connections that we also need and crave. We're not created in isolation. We're created to be part of something others. Families,
Right.
communities, our church relationships, those are there for a reason.
Yes, absolutely. There was a great study, I'm sure you're familiar with it, the Grant study, and it was out of Harvard, and they studied a group of men. I think they started in the 30s, and they went for their entire lifetimes, and they talked about what was the key to happiness, and they talked about all different socioeconomic groups,
Yeah.
and the key factor was relationships,
Wow.
community. That's what they discovered. It was all about community. So we know it's so meaningful. That's why this past year has been incredibly challenging.
And that's why, going back to the tsunami analogy, we don't really know the full consequences of what this last year and maybe a year and a half, maybe 2 years is really going to have on the young hearts and minds, as well as the families and our community.
Right. Okay. Amazing. All right. So we're 2 months into 2021, right? We're in February. What can we look forward to? What can we expect? Dan, what do you think?
Well, I think uncertainty is going to be the new norm here, right? And being able to live our lives with a certain level of uncertainty, and that's just going to add to all the other stresses on us and our mental health, I think. So I think that's at least for the short term and maybe even long term, right? I think the silver lining also on this is that we're more open to talk about these mental health needs. I mean, would this have been a conversation that we'd be interested to a year ago or 2 years ago?
Mm-hmm.
I think the ongoing pandemic and all of the social unrest and injustice that we are having conversations about has allowed us to be more open to conversation about emotional and mental health.
Right.
And when we are able to reduce the stigma, I think and have these types of conversations, and so thank you for it, then we're able to therefore more like people to more likely seek help.
Right.
And the care they need. So I think that's going forward. Even before the tsunami, 1 out of 4 individuals were struggling with mental health.
Wow.
So this has only gotten worse. So if we go back to normal, we still have 20-25% of our population that are struggling with mental health concerns, and it affects everything, our relationships. It even affects us physically.
Right. No question.
No question.
No question. Okay. Fantastic. Now, let's take a minute and answer some questions. Are you up for that?
I would love
Let's
it.
do
Thank
that.
you.
Let's do that. So let me take a peek here and see what we have coming through. I've got a couple of questions here. Number 1, Nancy. Thank you for asking the question, Nancy. She wants to know, are we offering in-person counseling as well as telehealth at this time?
On a case-by-case situation, yes.
Okay.
There are situations where the need is there, where we need to do in person, following all the protocols that we can, the distancing, the mask wearing, and so forth and so on. But yes, when the counselor identifies that there's a real need and face-to-face needs to happen, it does. We also, when we can, have group therapy, and we're being able to creatively still doing group therapy together in a safe way. It takes a special place, a special room, and so forth. So yes, but when it's needed and when it's necessary, and I think that's part of that hybrid approach, that you have a situation where we can have connections like we're doing now, and the ease and comfort of that, but also maybe from time to time, let's do that face-to-face check-in.
Sure.
When we do our outreach for our SUD program, we found out that when we go into a home, we're able to see and observe a lot more things than what a person wants you to see on the camera. And so we found out that those opportunities, when we can make that happen, we're able to help those individuals a little bit more, because we're able to see what's going on in their life.
Sure.
And be able to meet them where they're at. So.
Right. Yeah, I would imagine then that folks in that recovery process, that community is
Yes.
a big piece of that.
Yes. And so where you can find it, particularly with group,
Right.
where you can hear other people's stories and you can hear their encouragement and so forth, is powerful. It is very powerful. And much like where we started, we're wired for that connection.
Yes.
So
Yeah.
they're finding creative ways to do it safely. And we expect that that'll be more and more the case moving forward into spring and summer.
Okay,
Yeah.
wonderful, thank you. Let's look at another question. I have a question here from Lexi. Thank you, Lexi. How can the Grand Rapids community be supporting Wedgwood amidst all this pandemic difficulty? What can the community be doing?
I think the conversation is key. I think being aware of our neighbors and our friends, I think, is key. We talked about this incongruence between the environmental conditions and what we've been dealing with for a year and the number of reported abuse and neglect. That means that we don't have eyes close to where people are that need the help. And so finding ways to connect with at school and at the workplace and be aware and sensitive to what's going on. Come alongside them as a friend. So I would say awareness, but I would back that up. I would say awareness with your own self. I think it starts with recognizing where each of us are at and dealing and being honest with, you know what, is this the blues or is it something more significant? And am I finding myself even more withdrawn? And how is it affecting me? So self-awareness is really key. Talking to your primary care physician openly about these things, I think, is really going to be key as well. So I would say self-awareness, and then keeping your eyes open to those friends, especially those individuals that have pre-existing medical conditions, those that may have struggled in the past with some psychiatric care and needs, or individuals that have a previous substance use disorder or are in recovery themselves.
Right.
Connect to them, social media, direct message, call them up, see how they're doing, checking away. I think that's the best thing you can do for your family and the community. And Wedgwood would be there, ready and willing to help come alongside those natural supports and help people where they're at.
Right. Excellent suggestions. And I love the idea of really checking in. I have a good friend who we will text and we'll check in with each other. Hey, how are you doing? And she's so great. She'll write, how are you? Comment, really. So just really giving people, because it's rote. We say, oh, I'm fine. But if somebody pushes, how are you really doing? So checking in on neighbors and families, but also being vulnerable ourselves and acknowledging how we're doing. Good stuff. Thank you. I have another question here from Andrea. Thank you, Andrea, for the question. She says, I'm curious, in this work environment, how tough is it to find people to do this work here at Wedgwood?
It is tough. There is, it takes a very special person. You have to have, there's degrees, there's qualifications, there's a level of skill that you have to have, but you also have to have the right heart and attitude. So it's a special person that can do this and do this well. But I would say, right now, what we're hearing and what we're seeing, and I'm talking to other like organizations all across West Michigan, the need for counselors is growing. So some individuals have decided to get out of the work because it is some of the most difficult work that's here, the most rewarding. Where else do you get opportunity to transform lives? But it's difficult, and so if that tsunami is coming, right? Where we have a greater potential for need combined with the same or less trained professionals qualified to meet that need, that for me I think is a dangerous equation. I'm a little worried about that. But the character and the heart of the individual is so special. You're not going to get rich doing this work, but the people that thrive in this work are people that have a mind to store up treasures in heaven more than treasures on earth. Being a part of changing a life and a family. Remember a story I talked to you about our behavioral health technician? That's what drives her, that's what gets her up. If that's what motivates you, come on over. Right. It's going to be a tremendously rewarding work. But I'm a little worried that we have qualified enough counseling to be ready. And technicians, behavioral analysts, behavioral technicians that can be ready to meet the needs of this mental health tsunami that's heading our way.
Okay, so are we talking master's level counselors? Is that, so if you know somebody's going to school right now, there's going to be a need, is that what you're saying?
There is going to be a need. You will not be without a job.
Right, Interesting. Let's take one more question.
Super,
Dan?
thank you.
Here's a question from Mary Beth. Thank you, Mary Beth, for asking this question. Have the negative aspects of the pandemic provided positive opportunities for spiritual growth or support?
Wow, that is a great question, and I would say yes. I think in times of crisis, we rethink what's important to us. We take inventory of what really matters to us,
Right.
and so I would say yes. I mean, when we think about our families, our jobs, and our community, I think we take inventory of what really matters in times of crisis. And I think we get back to the basics. We get back to what truly drives us, what truly makes us happy, and who we truly want to be in this organization. So in this community. So yes, that there's a silver lining there, isn't it? And I would say Wedgwood is in a wonderful position in that regard. Wedgwood Christian Services, we do this work, hard as it is at times, not for our own benefit, because we serve a higher calling. There's something that we take to work every day, knowing that what we do in our own little corner, wherever it may be for that day, can count for eternity. And so those drivers, those intrinsic drivers to serve something larger than self, and to be a part of a larger community that feels the same way, I think is what this community needs right now. So I appreciate the question. I think that's exactly the answer.
Great. Thank you, Dan.
Yeah.
Thank you. Now, if we didn't get a chance to answer your question, not to worry. We will answer all the questions online in the comment section. So continue to keep those coming. We will address those. Thank you so much. Now, Dan, I want to thank you. I want to acknowledge you for your leadership during this transition, during this extraordinary time. Also, the way you are challenging staff to think differently and the way you are championing innovation.
Thank you.
So, thank you for that, Dan.
Vivian, thank you so much. It's a pleasure working alongside you and your wonderful team here at Wedgwood. Truly an example of doing grace-filled care, exceptional way of approaching things. I'm glad to be in this journey with you. So God bless. Thank you.
Thank you. And thank you, women of Wedgwood. We are so thrilled that you chose to join us and be a part of this conversation. We appreciate you. Have a great afternoon.